President Trump appeared on national television today and made an announcement that will raise a lot of questions. We will try our best tonight to answer them for you. The president said pregnant women should not take acetaminophen, the active ingredient in Tylenol.
That is because, the president claimed, use of Tylenol in pregnancy is linked to a rise in autism in children. Our Dr. John LaPook is here to help us understand the implications, but we begin with Ed O'Keefe at the White House. Ed?
Good evening. The president's been under enormous pressure from his health secretary, Robert F. Kennedy Jr., and the movement the secretary leads to figure out the increase in autism cases across the country in recent years. And the president said what they announced today is just the start.
President Trump today tried reversing decades of medical advice given to pregnant women.
Don't take Tylenol. There's no downside. Don't take it.
Specifically, the Food and Drug Administration is set to tell physicians that using acetaminophen, an active ingredient in Tylenol, during pregnancy can be associated with increased risk of autism, and that pregnant women should use it only in extreme circumstances.
See cases of extremely high fever that you feel you can't tough it out, you can't do it. I guess there's that. It's a small number of cases, I think.
Health and Human Services Secretary Robert F. Kennedy Jr. has spent years pushing unproven theories about what causes autism.
And we will be uncompromising and relentless in our search for answers. We will perform the studies that should have been performed 25 years ago. Whatever the answer is, we will tell you what we find.
Just last month, Trump's own FDA said it has not found clear evidence that appropriate use of acetaminophen during pregnancy causes birth or development issues. The parent company of Tylenol said it's the safest pain reliever option for pregnant women. That's because ibuprofen and aspirin are already discouraged for pregnant women due to risks of miscarriage or birth defects.
What do you say to those that say what you're doing today potentially just introduces more confusion into the debate?
I think women for many years, in fact for decades, Ed, have been confused by the rapid increase in autism in this country. In the childhood epidemic, that is chronic epidemic, disease epidemic that is plaguing America's youth. Women are confused about that and they want answers to that.
Today's announcement is part of a years-long push by Kennedy to remake the nation's public health system. Democrats have called on him to resign.
Every single day there's been an action that endangers the health and wellness of American families.
While the latest CBS News polling shows a majority disapprove of the job he's doing.
And there is strong criticism of the announcement from the medical community. The head of the American College of Obstetricians and Gynecologists called it highly unsettling. The top officials, quote, are willing to make an announcement that will affect the health and well-being of millions of people without the backing of reliable data.
All right, Ed O'Keefe at the White House, thank you.
Joining us now is CBS News chief medical correspondent Dr. John LaPook. Dr. LaPook, don't take Tylenol, no downside, tough it out. The president said all three. Your reaction?
It's not a matter of toughing it out, John. I mean, you have to remember that high fever and pain during pregnancy can harm not only the pregnant woman, but the developing fetus as well. And that's why Tylenol, acetaminophen, has been used for decades.
So, should an expectant mother take Tylenol, yes or no?
Well, it's tricky, right? Because there's really no good alternative. You cannot prescribe aspirin, ibuprofen, because those have really potentially very serious side effects. And that's why the recommendations that you heard today, and also from organizations, is use the smallest possible dose for the smallest amount of days possible.
Is there a scientific basis for the link the president claimed between taking Tylenol and autism?
It's complicated because the literature is conflicted. You know, there are some studies that show there's potential link of Tylenol use during pregnancy to autism. Others say there isn't. That includes a very large study over 25 years of 2.5 million children in Sweden. And I would have loved to have seen, as in the past, we say, show your work, the data, the thinking behind all this. I would love to see it written down. I will say that I was very happy to see that there's going to be a lot of money, time, and effort that's put into the whole field of autism. We certainly need it.
Okay. Dr. LaPook, thanks so much.
We begin tonight with the President of the United States promoting a link between the risk of autism and the active ingredient in an over-the-counter pain and fever medicine. The president, flanked by his health secretary, Robert F. Kennedy, told pregnant women to only use Tylenol if they can't, quote, tough it out. The announcement of a link is drawing criticism from scientists and doctors who say there's not enough evidence to back the claim. CBS News medical contributor Dr. Celine Gounder joins me now. Dr. Gounder, let's just start with the basic question. Is there a proven link between prenatal use of acetaminophen and autism?
No, John. The best evidence we have does not show that Tylenol causes autism. They cherry-picked a couple studies that they thought backed their claims. They ignored the lion's share of studies that argue against Tylenol causing autism. The best recent study argues against a causal link. This is a study from Sweden looking at siblings, 2.5 million births. And when they compared siblings, so they're controlling for family genetics and other risk factors, they found no association with autism and ADHD. And I also want to note major medical organizations continue to advise that Tylenol can be used during pregnancy. These are the people who care for and about their patients. They have no political points to gain here.
What's your biggest concern then about what the president and his team said today?
The president said multiple times that there is no downside to not taking Tylenol during pregnancy, other than a mother would have to tough it out. And that's not actually correct. I worry that this will scare women and that pregnant women may avoid Tylenol even when it's entirely appropriate. So, for example, to treat a fever. Fevers and infections during pregnancy can cause neurodevelopmental disorders, including potentially autism. And guess what? Many women will take Tylenol when they have a fever or an infection, but it's not the Tylenol that's causing the problem. It's the fever or infection. Tylenol remains the go-to option during pregnancy. Other medications like aspirin and ibuprofen can cause heart and kidney abnormalities in a fetus, especially if they're taken in the third trimester. So Tylenol is your best first-line option. And the next line option for pain would be opioids.
Mm-hmm. Dr. Celine Gounder, thank you so much. The president's pronouncement late yesterday that pregnant women should avoid Tylenol led to a lot of phone calls today to doctors' offices.
Women, understandably, have a lot of questions about the safety of Tylenol's active ingredient, acetaminophen. So we asked Jerika Duncan to dig deeper into this.
If you're pregnant, don't take Tylenol.
President Trump's warning yesterday rattled the medical community.
Tylenol during pregnancy can be associated with a very increased risk of autism. So taking Tylenol is not good.
The president's claim, without presenting new evidence that the over-the-counter drug is linked to autism, is getting major pushback from medical groups. The American College of Obstetricians and Gynecologists issued a statement saying not a single reputable study has successfully concluded that the use of acetaminophen in any trimester of pregnancy causes neurodevelopmental disorders in children.
I was around 20 weeks, and I was taking Tylenol.
Dr. Lucky Seacon is an OBGYN and fertility doctor in New York City and a mother of two who says she took Tylenol during one of her pregnancies. Can pregnant women safely take Tylenol?
I'm telling all of my patients, if you have fever or you have pain in pregnancy, even in the first trimester, it is safe to take Tylenol.
If left untreated, doctors say high fever or severe pain can cause more harm to the mother or fetus than the drug itself.
We're not saying everyone should pop a Tylenol every day. We're saying if you have a fever, if you have pain, you need to treat it. And I think the messaging of tough it out is something that, unfortunately, we have said to women in healthcare in this country for far too long.
The largest study of its kind, released last year, involving nearly 2.5 million children in Sweden between 1995 and 2019, found no causal link between autism and acetaminophen use in pregnancy. Co-author of the study, Victor Alkovist, says acetaminophen is still the safest drug during pregnancy.
The alternatives to acetaminophen in the US might be other medications with less safe profiles, such as opiates or other things to manage pain.
The Food and Drug Administration says it will now put a new warning label on the drug. Kenvue, the company that markets Tylenol, says, quote, "We believe independent sound science clearly shows that taking acetaminophen does not cause autism."